Good morning, party people. Oh boy, did I get your panties in a bunch over this DOMD shit. Let's talk about that some more. Yeah, I did a video last week about the whole DOMD, what I suggest you do if you're somebody that can't get into a U.S. medical school. Oh man, I got some backlash on that. You guys all think you should go to a DO school first before a Caribbean school, and I'm gonna tell you why. I'm gonna explain a little bit better. Maybe I didn't come across quite correct last time, so I'm gonna explain to you why it's better to go to one of the good Caribbean schools to get an MD instead of going to a DO. So the last video I basically said that, a lot of my friends, and this is, first of all, I started medical school in 1999, and this is my experience over the last 19 years of being in IMG and also speaking with thousands, probably, I don't know, maybe 10,000 students and doctors and everybody, nurses, healthcare providers, program directors, people who are evaluating students. This is not just like from a student forum, SDN, you guys pull this from, that are a bunch of students that haven't been through the process yet. So this is what irritates the shit out of me, is you guys are talking all this shit about how you think you know what you're talking about, but you don't, because you're pulling your information from somebody else that has not experienced this. So if you want to, I don't know if you know this, but if you want to excel in something, you go get somebody that has already done that and you take their advice. You don't go get somebody that has not done it. If I want a six-pack, I ain't going to go ask a fat guy what to eat. Hello? This is my experience, and this is what I'm pulling from to tell you that I think you can have more an advantage if you do what I'm telling you, which is to go to one of the big Caribbean schools instead of the DO schools. Let me reiterate that I think you can be a fantastic doctor either way. That's not the point. The point is how are you setting yourself up for the future? How do you give yourself the best advantages and the least disadvantages, because both of them have advantages and disadvantages. From my perspective, in speaking with all these people and going through the process myself, I see that many of my friends who are DOs are irritated about a lot of different things about being a DO. There's, of course, people that are irritated about being an IMG as well, but in my experience, that fades during residency. If you're looking over the long term in your entire career, when you're about to retire, you're still annoyed to be a DO because everyone has, is thinking like you're a different doctor. And when I say everyone, I don't mean everybody. Obviously, some people know, some people don't know. Or you don't even remember, you're about to retire, you don't even remember that anymore. It's not even part of your ideal of yourself. This is the important thing. It's not like you're getting people every day to say, oh, you're a DO, oh, I'm not sure about this, blah, blah, blah. But you have it ingrained in you. During school, everybody talks about it. This is what my friends tell me, and I have a lot of DO friends. Then it's like, you have the ideal of yourself, right? Your self-image is a second-class citizen. Now, whether you are treated by everybody as a second-class citizen or not is something different. But if you view yourself as a second-class citizen, then you will think that people are treating you like a second-class citizen. It's a weird thing. The other thing I want to talk about is the match. Now everybody's like, oh, DOs match 100%, blah, blah, blah. You have such a low chance of matching in residency, and look at the numbers, and this is from the NMRP or whatever the it is. I don't remember anymore. National Residency Match Program, data, blah, blah, blah. You fuckers don't know how to look at data yet. You're looking at straight numbers that somebody is handing you. You have to go into that data and look exactly how the fuck these guys pulled this number. How is it that they got 50% of Caribbean students match and 100% of where the fuck is DO students match? Not 100%, right? Near 90%. And I'll tell you how. Is they pull all of the shit medical schools out there. They take that number, and if you're listening to me in my other videos, I have said multiple times, do not go to these other schools. There's like 3 schools out there in the Caribbean that you can go to and have a really, really good advantage in the match. St. George, 93% they match. Now people are gonna say, oh, well, they fail people out. They should fail your ass out if you ain't doing a good job. And I also tell you not to go to med school if you don't have your shit together. The reason I was successful is because I got my shit together before I showed up to med school. If you think you don't have your shit together and it's better to go to a DO program because they're gonna let you slide by and you can still match, then you're gonna be a shitty fucking doctor, and I don't think you should go to med school to begin with. The fuck think about that? You need to do something else. You don't need to be taking care of fucking sick people that are gonna die. It ain't for you. It's not that you're stupid or anything. You know, like, this is my thing. Like, I think everybody can do med school. It's not the, like, how smart you are. It's your commitment to everything about it. All the shit classes that you don't really need. All the little stupid things you have to memorize that you're never gonna use again. You do it 100% because that trains you to always do 100%. And then you'll do 100% in residency, and you'll do 100% for all of your patients, right? I played baseball when I was younger, and they say you play how you practice. So med school, obviously you have to learn the basics of medicine, but it's also a little bit of how you practice is how you're gonna play. And if you practice in med school with a C-, you're gonna be a C- doctor. I don't want you taking care of my family if you're a C- doctor. That. Now let me talk about your opportunity as an IMG in one of the bigger Caribbean schools in the match, and doing in the specialties what you want to do. Because a lot of people have come to me because I got a surgery specialty from a no-name school, which I don't recommend. If you're a DO, you have a smaller pool of programs that you can go to. That's just the way it is. If you're planning on family medicine, then that probably is the more sure route, minus all the other bullshit. Hating your degree for the rest of your life. Some people don't hate it. I know that. I'm gonna tell you right now, a lot of people do. They regret it. Or they don't regret it. It's more like they're annoyed by it, that they're different. By the way, I know you guys are probably thinking, what the fuck is this guy talking about? This is not what everybody says. You know why? Because everybody wants to build their YouTube channel, and they have little fucking nice hunky-dory stories for you, and the little pretty background, and they got their little pencils, their little colored pins. Well, I don't really give a f. I am not making any money off this. I make literally like $600 a month on YouTube, and it ain't propping me up, and I don't care. I am doing this to tell people that were in my position to give them some advice, and this is the advice I have. If you don't like it, I don't give a shit. You can get the off my channel and go watch some pretty pictures. I don't care. Where was I? So the match, getting your specialty. Now, if you want a specialty like plastics, anesthesia, cardiac surgery, fellowship anesthesiologist, I got a friend who went to St. George. She is a fucking pediatric neuro anesthesiologist. Works in DC, one of the big hospitals there. There is no way in God's green earth that you are getting that shit as a DO. She got an MD, she went to St. George, she kicked ass, obviously. She's an amazing person and doctor, and she did what everybody says you can't do. If you want ortho, if you want neurosurg, you are gonna have a tough time doing that as a DO. Can you do it? Yes. In my opinion, it's harder to do from a DO school than one of the big Caribbean schools. Oh man, I was so hot yesterday when I was reading these messages. You little you don't know what the you're talking about. I say in the most, loving way. I totally understand where you guys are coming from, and I totally understand what the data is that you're looking at, but I'm giving you a perspective from somebody who has been kind of in that system. And am I biased towards Caribbean schools being? Yeah, probably, because I went there, right? Are you guys biased because you're probably applying to DO schools or you're a DO resident? Yeah, of course. So we have to take that into account too. We can't be stupid. We're scientists here, right? The last thing I wanted to say is about the merger shit. Everybody's like, oh, it's going to be the same. We're all going to be the same. It's going to be hunky-dory. I'm just going to be an MD like everybody else. There's going to be no difference. Are you kidding yourself? Yes, you are kidding yourself. You're only kidding yourself. You're not kidding anybody else. Do you think the program director who has been hiring medical students from MD schools only, because there's a lot of programs out there that do that, in 1 year they're going to change their mind to now accept DOs because it's all good because whoever the fuck is doing this is merging? No, that's a human being. You are not going to change the mind of some old crotchety motherfucker sitting behind a desk picking his residence, her residence. I will say that over time, since 1999, DOs have been much more accepted into allopathic programs. However, there is still a big uphill battle you have to overcome with those programs, and there's certain programs that will absolutely, those guys absolutely refuse to take DO students. I will be shocked if you are considered an equal. I won't be shocked because it's not going to happen. So I think your pool is going to remain small as a resident, as a DO resident. Now it is widening, that's no question. Since '99, it is getting bigger, but it is still harder, and you will not be considered an equal. IMGs are not considered equal either, but there are a lot of programs that understand that these schools produce, those schools are hard, and they do fire people, or they do kick people out if they don't pass. And so that's why they are okay taking these students. And for the most part, those students, when they get a high score from St. George or AUC or Ross or maybe Saba, those are probably the only ones I would say, they know that student's going to be an ass kicker. They already know it because they have history. They have a long history. Since they had not been accepting DOs, they're hesitant to do that because they don't know what they're going to get. They don't know if they're going to get an ass kicker or a flop. And so the first, getting your foot in the door from your school into a new program is difficult. If you have a student that from your school as a DO goes to a brand new residency program and they do shitty, they're not going to take that fucking school anymore. I mean, this is from me being on the other side, looking at applicants and talking with the people who decide who they want in the residency program. I would pick them, I would say, I want this student, I want that student, blah, blah, blah. And then it would go to obviously the program director and the surgery chairman and a couple other people, and they would decide who gets ranked, how they get ranked. But I was in those conversations, and unless you have been in those conversations, then I think there's very few people out here on YouTube that have been in those conversations and been in that room choosing students. And so if you're not, then you can shut the fuck up. Don't get mad, man. You guys don't get mad. I'm doing all this stuff. Number one, it's fun. Number two, I'm truly trying to help people. And if you're in a DO med school right now, it's okay. You're gonna be fine, right? But this is if you're not, and if you're looking at that, then this is my opinion. I'm probably splitting hairs. It's probably, very small differences and advantages and disadvantages. Over the career, I see it better as a IMG, as one of the big Caribbean schools, but, you can have just as good of a career. Well, probably not as good. You can have a great career as a DO and an IMG. So either way, I hope you guys get what you want, and you should always kick as much ass as possible. And definitely leave comments in this video because it's going to be fun, and I'll respond to as many as possible with some sarcasm and or profanity as I see fit. All right, you guys, thank you for watching another long and ridiculous video. See you in the next one. Subscribe, like, share. I almost forgot my best point. If you think being a DO doesn't matter, why the f did Dr. Mike make a video explaining what the difference is between an MD and DO? And that's what all the videos are, is people explaining the DO MD difference. You know who they are? They're DOs. You know why they're explaining that shit? Because they're getting tired of explaining that shit. So they figured, let me do it on video, and maybe it'll get out there, and maybe more people will know that I'm a real doctor. Okay? That is case in point that it's a pain in the ass. It'll be a pain in your ass. Okay?